How to protect yourself and others. Know how it spreads. There is currently no vaccine to prevent coronavirus disease 2019 COVID-19. The best way to prevent illness is to avoid being exposed to this virus. The virus is thought to spread mainly from person to person, between people who are in close contact with one another within about 6 feet, through respiratory droplets produced when an infected person coughs, sneezes or talks. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Some recent studies have suggested that COVID-19 may be spread by people who are not showing symptoms. Everyone should hands wash. Light icon. Wash your hands often. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place, or after blowing your nose, coughing, or sneezing. It's especially important to wash before eating or preparing food, before touching your face, after using the restroom, after leaving a public place, after blowing your nose, coughing, or sneezing, after handling your mask, after changing a diaper, after caring for someone sick, after touching animals or pets. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. People arrows. Light icon. Avoid close contact inside your home. Avoid close contact with people who are sick. If possible, maintain 6 feet between the person who is sick and other household members. Outside your home, put 6 feet of distance between yourself and people who don't live in your household. Remember that some people without symptoms may be able to spread virus. Stay at least 6 feet, about 2 arms length, from other people. Keeping distance from others is especially important for people who are at higher risk of getting very sick. Head side mask. Light icon. Cover your mouth and nose with a mask. When around others, you could spread COVID-19 to others even if you do not feel sick. The mask is meant to protect other people in case you are infected. Everyone should wear a mask in public settings and when around people who don't live in your household, especially when other social distancing measures are difficult to maintain. Masks should not be placed on young children under age 2, anyone who has trouble breathing, or is unconscious, incapacitated or otherwise unable to remove the mask without assistance. Do not use a mask meant for a healthcare worker. Currently, surgical masks and N95 respirators are critical supplies that should be reserved for healthcare workers and other first responders. Continue to keep about 6 feet between yourself and others. The mask is not a substitute for social distancing. Box tissue. Light icon. Cover coughs and sneezes. Always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow and do not spit. Throw used tissues in the trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol. Spray bottle icon. Clean and disinfect. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. Then, use a household disinfectant. Most common EPA-registered household disinfectants. External icon will work. Head side medical. Light icon. Monitor your health daily. Be alert for symptoms. Watch for fever, cough, shortness of breath, or other symptoms of COVID-19. Especially important if you are running essential errands, going into the office or workplace, and in settings where it may be difficult to keep a physical distance of 6 feet. Take your temperature if symptoms develop. Don't take your temperature within 30 minutes of exercising or after taking medications that could lower your temperature, like acetaminophen. Don't forget to share this video with your friends and like it. If you are not subscribed before, please do it now. See you again in another video.